A community group has urged the government to set up a national office dedicated to suicide prevention in Singapore. Project Hayat launched its white paper on World Suicide Prevention Day. Now, it outlines strategies such as monitoring data and more training on suicide prevention. Its research found more than 80% of respondents feel that suicide prevention is of national importance, but less than a quarter say the country is doing enough to prevent suicide, and just over half know how to access support services. Most also believe more effort is needed in schools and workplaces. It proposes a national office under the Health Ministry to better coordinate suicide prevention efforts with a dedicated budget. Other suggestions include more public education and use of technology to improve responses to those at risk. Now, findings will be presented to the government, schools and community leaders this month. The white paper is a result of interviews with experts, focus group discussions and 500 public respondents in Singapore. It cited a study of countries that rolled out a national suicide prevention program. They saw suicide rates fall, especially among men. The Health Ministry says many of the paper's recommendations are already in place or being implemented. It adds that the National Mental Health Office to be set up by next year will mean better synergy of interagency efforts. And for more on this, I'm now joined by the principal researcher and co-lead of Project Hayat. Dr Rayner Tan is also visiting research fellow at the Swee Hock School of Public Health at NUS, and he is joined by Reshii Varma, a project participant and suicide survivor. A warm welcome to the both of you, and thank you very much for being here with us in the studio. Dr Tan, your report essentially asking for more government-led initiatives. Share with us why this should be a priority, and what would some of these initiatives look like?
Thanks so much, Shahida. I think, we do have a current section in the report that outlines all the current efforts that are already being done in Singapore by the government, by community groups. But typically, the WHO, the World Health Organization, outlines an implementation plan. And part of this implementation plan would be to do a situation analysis. And with a situation analysis, this is what we're doing with our collective effort with Project Hayat, to really see what has already been done and to really offer maybe like a pathway, to maybe doing something more comprehensive as a whole society effort.
And what do some of these initiatives look like?
So in terms of our recommendations, definitely setting up of a National Suicide Prevention Office is something that we've learned from our international experts. So we did interviews with international experts, we did our desk review of case studies, and one key success factor really is to have a dedicated office. In some countries, it will be within the national mental health, like a department or a ministry, and this has dedicated resources, dedicated budgets, dedicated data monitoring kind of mechanisms. So these actually allow for our country to actually monitor progress on suicide prevention and also roll out evidence-based interventions.
These measures essentially can range from upstream prevention to downstream interventions, isn't it? Reshii, we are so glad you can join us today. If you could, tell us more about your lived experiences and the importance of having important conversations about suicide among our society.
Yes, thank you very much. Okay, so it all began when I was 18 years old. I started having a lot of suicidal thoughts, but only at the age of 19, I decided to step up and seek help. So that was really important step for me and especially for my family to be there and support me. So it wasn't an easy journey, definitely, but it takes a lot of courage to know that people are out here, they love you, and there's so much more which you actually can see. So it's best to actually have hope with yourself so you can continue moving on.
When you were going through that phase, did you try to reach out and have conversations or discussions with other people?
At first, I was unaware about what was happening to me, so I decided to speak to my family about it, but they thought it was just stress. So I decided to speak to some of my friends about it, and they told me that they do not understand what's going on with me. So it was a bit confusing, but I think research on the internet actually helped me a lot to realize what was my actual issue.
It does take a lot of courage, isn't it, Reshii? And we're so proud of where you have, what you have become, where you've reached. And these discussions, though, they still tend to be secretive, right?
Yes.
They can be clouded by stigma and misconceptions. Do you think that certain government organizations, they can play a crucial role in trying to intervene or help pull a person away from suicide?
Definitely, there are plenty of ways. It really depends on how you actually want to do it. So it's not a very easy thing to do. There's a lot of research to actually implement, and that's where Project Hayat actually comes in. Yeah.
And how has taking part in Project Hayat helped you to understand more about this issue?
Definitely, I actually joined Project Hayat as a participant in the focus group because I believe that having people with experience share their problems give more insights to research. So we actually play a really important part, and our stories are very important.
And indeed, these stories are very important, Dr. Tan, but the stressor, the reality is that, the stresses can come from various places. For example, we have women juggling multiple roles. We have young people dealing with relationships and social issues. Do you think there are groups of people that are more vulnerable to such tendencies and should therefore get more help?
Absolutely. I think one thing that Reshii also highlighted was that this was a very participatory process that included many different communities that were involved in our focus group discussions. They were also involved in our working group, actually. So, one thing that we've really learned is that because stigma functions in like layers, right? There's the stigma of like suicide, the stigma associated with maybe mental health, and different communities will also face different barriers to accessing care. And I think some communities might face more stigma than others. Maybe by let's say in Singapore, we know, like, say, for example, the migrant workers, sexual minorities, different groups might face these like prevailing stigmas. But one thing that I think really would be a way forward is that if we do have a national plan, and this plan focuses on equipping everyone with suicide intervention kind of skills, identifying who is at risk, being able to maybe make a safety plan for people, because the first responders are not going to be there 24/7 for everyone. So
Sure.
I think equipping communities with these skills would be really important.
And when someone commits suicide, it's really the family and the friends who are left to live with the pain, right? What is the common reaction that you hear from loved ones who have undergone such experiences, Reshii?
Definitely a lot of sadness and in denial. They can't accept what is going on. And a lot of people kind of say like, oh, just because they suicide, they have an underlying medical mental condition. And that's not always true, because there could be someone who's actually facing some financial issues or relationship issues, and that could cause them to commit suicide.
Yeah.
So it's not easy for a family to go through this, but it's always best where we can actually provide help and educate them on why these things happen.
And based on your experiences with Project Hayat, how can these programs or recommendations help those families as well?
Definitely getting them to understand better and normalizing this stigma. So everybody will feel safe, and people will kind of step up and share their stories and not be afraid to actually be seen as weak.
Dr. Tan, you were sharing a little bit earlier about the misconceptions, but really, what is the one myth about suicide that you would like to debunk?
I think this one myth is something that I also, is a misconception that I had, before embarking on this study and learning from the community, right?
Yeah.
That, suicide is all about mental health. But, not every person with a mental illness is suicidal. And not every person who is suicidal has a mental illness underlying it. And, I think that was a really key learning point for me. So, when we were working on suicide prevention, it's really thinking about, mental health, yes, because a lot of the conversations and the access issues to some of these services are based in mental health stigma. But we also have to think about suicide on its own as well. What are the ways of restricting means to offer, suicide earlier you talked about leveraging technology and
Yeah.
stuff like that. I think we've learned that some of these things, like using infrared beams to detect when people get into an unsafe or unauthorized area for high-rise buildings, or using AI, for example, to monitor social media. These are some of the things that are maybe more relevant to suicide on its own without touching on like mental health. Yeah.
There are many ways to get to it, and suicide itself is such a complex, very multifaceted issue. Reshii, what is it about suicide that you want people to understand better?
Definitely, share this again, where suicide is just not about someone who is having facing some mental struggles. It's more of what is happening at that moment for them. Because as I was sharing earlier, that external factors, actually external pressures from societal expectations and laws could be a cause of it as well.
Yeah, and Dr. Tan, going back to you, we were talking about these government-led initiatives that Project Hayat is calling for. Why should a nation set aside resources to help people who want to end their lives?
I think, really something that we all really, believe is that every life lost to suicide is one too many. And, I think even beyond that, if we look at the evidence out there, there are cost effectiveness studies that look at, investing in suicide prevention and the return on investment. There was one study that I think was published in 2017 in the UK. Every £1 invested, you get about like £39 back in terms of the returns. So, there is, humanistic justification. There's a reason for that, but there's also even an economic justification for this. So, I think we need more studies. I think this is something that we are finding, that we are in a space where we need to do more research on suicide, gather more data, understand the landscape better, and we'll be able to have a better view on what we can do.
More still needs to be done, but these initiatives or recommendations are definitely a step in the right direction. So thank you very much, Dr. Tan, for coming in to speak with us. And Reshii, thank you so much for being so brave to share with us your story about suicide. Thank you very much, gentlemen. And that was Dr. Rayner Tan from the NUS Swee Hock School of Public Health, and Reshii Varma, a suicide survivor.